Welcome to the program. Can you believe it's the final day of November of 2021? Where has the time gone? Which means we're officially in the holidays, but maybe you're a little concerned about the holidays coming up. Maybe you have some pain in your extremities you'd like to get rid of. Well, we have just the guy to talk to who has the answer. Of course, we're talking about Dr. Josiah Fitzsimmons from Vero Neuropathy is joining us right now, the founder of Vero. How are you, doctor?
Hey, Lou, I'm doing great. As we were saying, we had a great Thanksgiving. We gave away over 700 pies last week to all of our patients.
Wow, that is really impressive. Really taking care of the patients, which is something you do unlike anybody else that we have seen. That is so important to your practice, isn't it?
Yeah, it was a lot of fun. I said they're pumpkin pies, so they got their vegetables.
So yeah, you're making them healthy all the way around, which is really cool. But we're here to talk about the way that Vero treats neuropathy pain and the methods you use, because it's a little different than typical treatments, isn't it?
Absolutely. You know, typical treatments for neuropathy focus on prescription drugs such as Lyrica, Cymbalta, gabapentin, or even dangerous opioids. All these things do is mask the pain. They also typically use injections or surgery, which can obviously have very big side effects. At Vero Neuropathy, we actually use electric cell therapy, which is non-invasive on the hands or the feet to actually regenerate the nerves, restore the arteries. The treatment's FDA cleared, and it's crucial to really get evaluated as soon as possible, because once you get up over 80% loss, typically it can never be fully reversed. I mean, we've seen patients that have wait too long and that can be in a walker or in a wheelchair. Obviously, we never want that to happen, so I can't emphasize enough. Get in as soon as possible so we can get you evaluated, figure out how we can get the best course of action.
Now, you mentioned some of those drugs earlier, and those drugs work rather quickly. How does the treatment that you use, work? How quickly does it work, and what does it entail?
Absolutely. The most common forms of neuropathy are in the hands and the feet. And as you can see in these demonstrations, the low-level electric cell signals actually send waves to the body to regenerate the nerves, restore the blood flow. Okay, we actually have a whole entire protocol that's actually going to help decrease inflammation, allow the body to heal. Patients can see a dramatic difference very soon. And with subsequent visits, in 95% of the cases, we can actually reverse the neuropathy fully, which is unbelievable for people.
And there are people that have been living with this pain for a long time, sometimes maybe even a decade or longer. Is this still able to be treated?
Absolutely. I mean, even in stage 3, taking medications on a daily basis isn't going to do much except cover the pain. We actually want to correct the cause of the issue, not just mask up the pain. We actually have a phenomenal testimonial from Dennis. He'd actually suffered with neuropathy for over 30 years. 6 weeks in to our protocol, he felt his feet for the first time in over 20 of those years.
I seen an advertisement on TV, and I told Deb, I said, we need to call them and see if I can get in and see them. So, if they could do anything to help me, because it wasn't getting any better. I'm taking medicine from the doctor to help relieve the pain, but that was not trying to cure it. So we got the call, got in, and come down and visit with the doctor, and he said he thought he could still help me. I was in 3rd stage, and he needed to do something pretty soon, or he couldn't do nothing. So we started, and I started feeling the difference in a week. I come 3 days a week first, and I do my therapy every day, light therapy and the water therapy. And boy, I could just tell the difference every week. It's just really impressed me. And it's such a feeling to feel your feet again after you can't feel them for so long.
Well, you can see the guy's beaming because he has feeling back where he never had it for a long period of time. But you mentioned that evaluation is key in treating this, and you have a special that's going on right now. We want to make sure people take advantage of that.
Absolutely. So that special includes a full consultation. We do a neuropathy-specific exam, which is 8 different unique tests where we calculate down to the exact percentage how much loss someone has in their hands or feet, and we'll have a full report to go over all their findings, lay out an entire game plan for each individual.
Okay, now how long will it take for someone to be seen? We know that offices like this are very busy. How quickly can you see somebody?
We can see people immediately. I mean, we have 7 doctors all in our one office. We all specialize in neurologically based care. We have people come 4, 5, 6 hours one way. There's really no reason to delay and keep living in pain. Call our office. Let's get you in as soon as possible so you can enjoy Christmas without doing this much pain.
Yeah, it's really conveniently located as well, a minute off of I-35 on Mill Civic Parkway in West Des Moines. So simple to get to, and boy, what a difference. One more time, Doctor, people want to take advantage of the $49 special. What do they need to do?
Yeah, give us a call, 515-755-PAIN. That's 515-755-PAIN, or you can actually text the word painless to 21,000.
All right, Dr. Josiah Fitzsimmons from Viral Neuropathy, thank you so much for making people feel so much better for such a long period of time, and hopefully we'll get a lot more people taken care of before the holidays.
Absolutely. That's the biggest thing we love to do is give people hope, and looking forward to helping more people.
All right, hey, take care of yourself. We'll talk to you next time.
Have a great day. Thank you.